Ever wondered how some students rotating through the NICU seem to know the patients really well and actually do a good job on rounds? Well, I'm going to give you 5 tips for you to be able to take great care of your patients and also blow away the medical team. So in this video, I'm going to go through the 5 tips that will make you take great care of your patients and also blow away your medical team. Tip 1 is just be honest. Tip 2, understand your patient. Tip 3, be prepared for rounds. Tip 4, you want to practice actually rounding. Tip 5 is be engaged. Really feel like you're part of the medical team and get others to feel like you really are making a contribution to the medical team. Okay, let's go into detail on tip number 1, which is being honest. It seems kind of silly that I would have to say to be honest, especially when you're caring for patients, but it is extremely important. Sometimes as a student, you may feel a little nervous. You may not have gotten time to look at all the labs. It's really important for you to be open and honest, and hopefully the environment that's created by the medical team allows you to do that. You want to be able to say, I haven't seen my patient. Sometimes, especially in the NICU, that's really unpredictable. You may be hard pressed on time. There may be an emergency that you had to attend to, or at least go watch as a student. And so it's okay to come back and say, I'm so sorry, I haven't seen the patient yet, but either I can do it right now or I'll do it as soon as we're done with rounds. So being fully honest and being open with the medical team, first of all, you gain a lot of respect from the medical team, but also remember, we're here for the best care of patients. Okay, let's delve a little bit on tip number 2, which is to understand your patient. When you rotate through the NICU, a lot of people might say, know your patient, know your patient, know your vitals, know your exam, read the diagnosis, and that's absolutely important. But you also want to understand the vitals. You want to understand the complexity of the exam. And you really want to understand how the diseases come together and how they affect your patient on a daily basis. And you want to see the big picture of, is this a sick patient, is this not? When you're first starting out as a student, that is a really important difference. And it seems like it would be easy. But in the NICU, there's a lot of in between, and a lot of that comes with experience, and that's where you really rely on your intern, your resident, if there is a fellowship program, or definitely your attending or professor to help you understand. And again, it's important to cultivate a culture on our end as attendings for us to be okay for a student or a trainee to approach to say, I'm not quite understanding where we are today with this patient. Can you please give me the big picture? So again, it's important to step back sometimes, look at the whole big picture of the baby, and really understand why this patient is in the NICU, when we could be going home, what's holding this baby from going home, and if it is sick, what can I do to make it better? All right, now let's talk about tip number 3, which is be prepared. So there are many ways to prepare yourself, and obviously as adult learners, we have different methods that can help each person. Each individual is different in the way they learn. Some people are visual learners. You have to see YouTube videos like this, and obviously if that's you, keep on coming. Definitely helps me out. One thing you can do is actually develop your own template, where you may be having a template of 5 days, and each day you're writing the labs down on your template. You're writing a description of a quick description of the exam for that day, maybe one or two or three of the plans that you carried out that day. So then the next day when you come in, you hear what happened overnight, you get the vitals, you get the labs, you look at the big picture again of that patient, but you can also look back to the reference that you had the day before, look at what the labs showed, see if there was a difference. Another way to be prepared for rounds and for the best care of your patient is to talk to your intern or your resident fellow attending before you round. And then you can ask them, this is what I'm thinking, this is what I'm planning on saying on rounds. Is this appropriate? Is this the right plan? And they can help you sort of structure your ideas and your plans so that you can really, again, shine on rounds and be best prepared to take care of the patient. Tip number 4, practice for rounds. I remember as a student, I used to get so nervous to stand in front of a room of health professionals. Everybody's looking at you. You're trying to remember all the diagnoses, the labs, the vitals. It's really nerve-wracking, especially if you don't know a normal flow of rounds and how you present. So you want to be at home, practice a little bit about how you're going to speak through rounds, what your structure is going to be like, so that you can go ahead and feel somewhat natural when you do it. I promise you, you're still going to be pretty nervous when you do it for real. You're still going to have a lot of eyes on you, but it will get better. I used to actually get so nervous for rounds, and as you get better and you practice, to me, rounds are one of the most fun things to do during the day. But I do know that the students, residents, they're nervous for rounds. So just keep on practicing until it comes out a little bit more natural. Tip number 5 is be engaged. You want to have the medical team look at you as part of the team. It also feels good for you to feel like you're part of the team. You want to be able to approach the nurses and say, hey, can I look at you as you place that IV? Can I help you with something? Same thing for other specialties or a respiratory therapist. Do you mind if I watch you while you intubate? Do you mind if I see how you set up a ventilator? Be really mindful of being engaged, not just standing there in front of the resident and saying, hey, can I help you? But really proactively go up to your intern, your resident or fellow and say, hey, I noticed you're busy and on rounds we talked about calling surgery. Do you feel like that's something I could do? And be able to help out in a very proactive way. This is really noticeable. And when I'm looking at evaluations and I'm looking at how the students did during their rotation, I usually ask the residents if they felt like the student was part of the team or were they just a bystander to the medical care of the patients. So really feel very engaged. So I promised at the end I would give you a bonus tip. And that bonus tip is to actually have fun. It seems pretty obvious. And at first, it may seem like you can't have fun in a NICU, but it actually is a really cool place. It is very scary for families and also for healthcare providers. But if you look at a lot of the physiology that happens, if you look at some of the patients that are in there and how you can, with your skills and your knowledge, can help patients out, it's such a wonderful field. In the NICU, you can really make a difference. You walk in, you talk to the families, you discuss things with the medical team, you learn from going to deliveries. And those things you might not see in any other rotation. NICU is one of those few rotations where you can actually see acute care, because obviously we have very sick kids, and also chronic care in general medicine. We have babies that are there for months, sometimes beyond a year, and you really get to know the families well and establish relationships and rapport. You can be part of that. So if you go in with a good attitude, positive attitude, really wanting to learn, and you walk in saying, you know what, I'm really gonna have fun in this rotation, I promise you will have fun. Again, thank you for staying with me. I hope you really learned something. Please don't forget to subscribe to the channel and click on that notification button. That way, as soon as I post something, you'll get it. So thank you again. It's been fun. We'll see you with the next video.